Hey, welcome back, everybody. It's time again for another episode of Health Talks with Dr. Trinh. The one show, the only show that shows you the path to a healthier life, one conversation at a time. And today, well, you're going to have to wrap your head around some wild concepts here, as Dr. Trinh likes to go into this whole idea of telemedicine and alternative health, and in this case, artificial intelligence. How are we going to use artificial intelligence to live healthier, happier, stress-less lives? Is that the topic today we're talking about?
Right. Yeah. Thank you, Paul. And welcome, Mr. Harry Glorikian from Massachusetts, right? Close to Boston.
Yes.
Yes.
We are good to be here.
Excited you're here. I know you've written 2 books and you're on the investor side and have done a lot of innovative projects with innovation. So when we saw your name cross our path, we were like really excited to bring you on and just kind of have you chat and have this as an open forum so we can learn more about what you do, who you are, and the books that you've written, especially when it comes to healthcare and artificial intelligence and things of that sort.
Excellent. Great to be here. Look forward to it.
All right, let's give us an overview of the book that you wrote that took me forever to type into the title here. It's definitely got a lot of bold statements in it. Give us the name of the book that you wrote on this topic, and then that'll kind of frame the discussion here today. What's the book called?
So the book is called The Future You: How Artificial Intelligence Can Help You Get Healthier, Stress Less, and Live Longer.
How in the world can artificial intelligence, this thing that tracks my habits on social media and predicts the algorithms of financial trades and all these other things that artificial intelligence does, possibly help me in my real world, real life?
So in reality, I don't think people realize they're using it every day, and it is actually making their life a whole lot easier. So if you do a Google search and it gives you what you want, there's a strong taste of artificial intelligence behind that.
Right.
When you're speaking to Siri or Alexa, there's artificial intelligence in there. It is everywhere, except you don't really know that it's there, and that's the best kind of technology, the kind that helps you and you don't even have to think about it.
Right.
And so the same thing applies in healthcare, where whether it be my Apple Watch that I'm wearing or my Whoop band, right? The information that it digests, processes, and then says, hey, this is sort of what's going on, and makes you aware of how you can improve your health. That's a lot of complex calculations going on. It's just putting it to you in a very simplified way so that you can do something actionable.
So let me ask you one more question. We'll let Dr. Trinh chime in here. I've often wondered, could artificial intelligence, could this robot help analyze the complex, confusing data that a patient provides, the verbal cues, the physical cues, the charts and everything, and come up with a quicker, better diagnosis? Because we've talked about how under the pressure of the modern medical system, doctors are forced to, they only got a few minutes with you. You got to get in and get out. Medicare only pays for so much. Their practices designed to get people through quickly and whatnot. And they're trying to make a lot of complex conclusions rather quickly. And I wonder if that wouldn't be assisted by artificial intelligence, if it couldn't get down to the root of the cause quicker, and then they could make some more intelligent choices. Is that ever in the cards?
The short answer is yes.
Okay.
It just depends on how it gets implemented, but some of that is already happening now. If you go to, like, Stanford has their own algorithm which will look at all the electronic record, medical record information,
right,
and it can actually predict with a very high accuracy if you could die within the next year.
Wow.
And then they will approach you and have that sort of, do you have your life together? We're seeing this as a potential, right?
Right.
And the more data the system gets, the more accurate it gets over time.
Mm-hmm.
There are systems that do remote patient monitoring. So if you're a primary care doctor
Mm-hmm.
and your patients have these kits and they're taking their measurements, instead of seeing them that one time, you've got a longitudinal view of data over time. And so you can manage that patient better. And actually you can manage more patients because there's more automation put into play.
Mm-hmm.
So those are just two examples, but there's a lot more.
What do you think, Dr. Trinh? We've talked about this too. It's not just as the technology available, would doctors use it? Would they listen to a robot's assessment? Would they listen to an algorithm and use that as a tool and not as a threat? Well, I know better than that does, and I've got 20 years experience.
I think most of us already go on Google and put in our symptoms to look for that diagnosis. And what's interesting is, can artificial intelligence be that initial triage person before it gets to the doctor? Kind of like an AI nurse that triages, why you're here, what are your symptoms, and kind of help narrow that diagnosis gap, right? To assist.
Yeah, there are systems where when you get to the office, you answer a number of questions and it goes through the same algorithm that's you learned in med school, right? When it's not that, and sort of go through it to narrow it down to something. But where I see these systems being used, and if because I try to read as many of the papers as I can, as you say, well, the doctor, is this level of accuracy and the AI system is this level. But when you put them together,
Mm-hmm.
the accuracy automatically goes up,
mm-hmm.
right? So it's the two together that get to that next level. And that's where I see the symbiotic relationship between the physician and, let's face it, we keep calling it AI, but it's just a tool.
Right.
Just a tool.
Right? And that tool is giving you a piece of information, and then you have to make that judgment call on top of what the tool is telling you. And if you think about it, right, like if you think about a diagnostic test or an X-ray image, that's a tool that's giving you, this is just taking a lot more data, crunching it, and giving you more of an analysis out of it.
So should doctors view it as such? You gave some perfect examples. We now have, in the last century, X-ray machines. We have other sorts of technology that gives us greater insight into what's happening inside the patient. And there's a lot of data that all these medical devices are collecting now, and medical procedures. This is a way to crunch that data quickly and come up with some possible alternatives. But I would think that, and maybe I've been reading too many science fiction novels, that doctors would be afraid of this, that they would think, I'm going to be replaced by this. They don't need the doctor. The robot, the artificial intelligence can play chess faster than I can, so why do I need to have a real player there?
Fortunately, healthcare is different than just choosing one move in chess.
Right.
The chessboard won't argue back, right? The patient, you've got to interact with another human being. So you really do need that human interaction. But, and this may sound a little controversial, like at this moment in time, although based on everything that's going on, I don't believe so. Mm-hmm. I think that physicians that are not adopting this, or healthcare systems that are not implementing this, are really on the border of not practicing the highest quality of medicine that they could.
Yeah.
If that AI system identifies a tumor or a fracture or a bleed in the head, and that makes a difference in how quickly or how accurately that patient gets treated, and you're not using it, that's a problem.
Yeah. I mean, I don't want to get legal about it, but it seems like you're not giving the best diagnosis. You're making life and death determinations in some cases with not all the data or the best data, or analyzing the data correctly. And again, because how can you, in this world of medicine where it's become, I hate to say it, more like an assembly line, but I've said that before, You got to get people in and out quickly. We're trying to reduce costs. We're trying to contain costs and everything here. And in the process, we're giving the doctor less and less time to ask questions, to think, to investigate other possibilities. And AI would crunch a lot of those things for them, I would think.
Well, think about it this way, right? If your washing machine or your car is getting close to breaking down, right? The light goes on,
Right.
Right? There's a system in there monitoring that all the time. When you have somebody in the intensive care unit, there are pieces of software that can sit there and all the beeps and all the boops and everything that's going on, and basically say, hey, bed 7, you guys should take a look at them, because in the next 48 to 72 hours, the data is showing that they could crash.
Right.
So you may want to intervene now. How many, like a human being, cannot monitor the beeps and the boops like on a momentary basis to see what's going on? It's just not, that's not how we're designed as beings, right? But the machine can sit there and be your assistant to say, hey, doctor, you may want to take a look at this, right? It costs a threshold. And I think it's a big help for what we can do today versus what we did. I mean, 5 years ago, if I give you a simple example, 5 years ago, if you just wanted to take your blood pressure, you probably had to go into, a hospital or a clinic or something. I have this portable blood pressure. I push a button, it takes the measurement. I don't even have to think about it. Boom, it shows up on my iPhone, and it shows me how the trend is going over time. Technology is sort of making what was really complex a whole lot easier.
How does that play into Dr. Trin's favorite topic here, which is telehealth, telemedicine? The idea that patients can be monitored for a lot of things at home, even after they've gone in. He had somebody on a while ago, even if you go in for surgery, why keep you there if we're just monitoring, I don't know, various sorts of things. We got to keep you in the hospital because only we can monitor this stuff. Why? Maybe this stuff could be set up to be monitored at home and get you home faster, which saves money and makes you happier and everything. How does this play into that whole telehealth field?
Oh, I think that's a total door opener to telehealth. And I know that people do not like the pandemic. I don't like the pandemic, but boy, the pandemic changed telehealth.
Yeah.
Right. Before the pandemic, it was, I don't need this. During the pandemic, it's like, where's my telehealth system? How quickly can I get that stood up? And so, I've been talking to remote patient monitoring companies, and we're seeing tremendous uptake in primary care offices so here's the issue, right? You give somebody a blood pressure thing, they take the measurement. How do you get that back into your system?
Exactly. And whoever sees it, the doctor's busy, and who in the chain is responsible? Does it send an alert? And who does it send it to? And then what happens afterwards and all that? Yeah. Right.
And so when you have these, turnkey systems, right? The system goes through all your patients. It looks at them and says, okay, the cardiac condition, it looks at the codes and it says, here's the box of items that should go to that patient. And they get it. And then all they need to do is plug in a hub that doesn't even work on Wi-Fi. It works off cellular. So it doesn't have, you don't have to worry about your Wi-Fi going down. And every time you take a measurement, it just uploads into the doctor's system. And every morning, whoever's out of line shows up. And then the system can send a message to the nurse saying, hey, call, Mr. and Mrs. Smith, right? Or if it's really serious, okay, the doctor should respond to this. But all of a sudden, you can manage a lot of patients. And oh, by the way, your ability to bill for this, you've got all the records. Right? So it's a revenue generator as well as you provide better service to the patients.
Has that been part of the objection? Is it all just, as my late father would say, it all comes down to money? Money's the answer. Now, what's the question? Is it just the cost of money of either implementing this, or in reverse, gee, if they don't come in, I don't get billed. I can't bill them.
Well, I mean, these are, jobs, and, these people are entrepreneurs, and they do, they have to run their businesses, right? You can't, you go to the tire shop, he doesn't do it for you for free, right? It's everything costs something. And so there is a cost to it. And so if somebody can figure out a way to, if I'm CEO of a company and somebody asks me to invest in something, I want to see the ROI, right? Otherwise, why am I going to implement that in my business?
Right.
It's just, this is now at a point where I think the ROI for both groups, not us, the entrepreneur, but the patient that's being served, really goes, way high on both sides.
What do you think?
Both benefit, which is a unique situation.
What do you think, Dr. Trinh? Is it all about money? Is that it? Is I've been thinking that doctors are just resistant to change and resistant to do something where they don't see the patient, because that's how they do it and that's what they feel comfortable with. And
there's a cultural thing. It depends on if you're a doc who is within 10 years of retirement, or if you just get out of school.
Isn't that the truth?
The younger docs love technology. They're ready for technology, and they grew up with technology. So some of the older docs, they like to see and touch and have you in person to discuss that. But certainly, technologies like remote patient monitoring has been shown to be able to decrease patients' risk for being hospitalized or heading to the ER. When I tell my patient to, check your blood pressure at home and see me back in 3 months, they see me back in 3 months and they bring this big package of blood pressure readings over the last 3 months. And I look at it and I say, I should have addressed this 2 months ago when it was super high and you never told me about it. And that could have been an ER visit, that I could have prevented if we knew that. So this is where remote patient monitoring and artificial intelligence may play a huge role, because you get to know what's going on in your patient's life real time, rather than looking back 3 months later at their blood pressure reading, their blood sugar readings, their whatever you're monitoring, right? And this is an opportunity to be proactive when you see conditions that pop up that you're using artificial intelligence, or you're using these tools to get that red light, right, pop up. This is a emergency that needs to be addressed now, rather than finding out that your patient's in the emergency room.
So what do you think, Dr. Trinh? Your guest mentioned that maybe COVID was a tipping point. You're in the front lines here. What do you see? Was COVID a tipping point for remote monitoring?
Absolutely. When everything closed down, and including doctors' offices, and nobody wants to walk into an office or a hospital, the only way we could deliver care was telemedicine. And then we realized, wow, this is kind of convenient.
Yeah, and maybe quicker. And maybe I get an answer, because I found myself in the pandemic, and even before then, something happens late at night, and all the round the clock emergency rooms and stuff have been scaled back, and there's no place to go, and the little emergency room down the block that I thought stayed open round the clock now only stays open until 9 o'clock, and it's 10 o'clock, and my grandchild just swallowed something. Or he's making funny faces, or he's looking sick. And I say, where do I go? How do I get an answer? So I think it gives a lot of relief to the patients. You can get quicker access. I think the doctors, as you say, can respond better and stay more in the loop. What is the final hurdle to adoption? Is it just us getting used to this technology and hard to use it? Is it paying for it? Is it finding ways to bill people when I read the reports and bill Medicare? What do you think? I'll go back to our guest here. What do you think the final barriers are to adoption?
Well, I think it's got to be an easy to use system. That's first of all, right? It's got to be easy to implement. It's got to be turnkey, right? You cannot ask the physician or their office to be the IT help desk.
Okay.
So that needs to just magically happen, and that's happening.
Right.
You need to be able to get the right equipment to the right patients, right? And that's happening, right? And then you need to be able to bill for it because, again, this is part of the services that are being provided.
That's the way medicine's set up, pay for service, pay for fee. Yes. And so if they're going to put effort into this and treat it seriously, then doctors should be and will expect to be compensated for the time they put into this, right?
Correct. Or even value-based care where, what you're being paid for is outcomes,
right.
keeping somebody healthy.
Right.
And, you do that and all of a sudden you find out if you're not monitoring them, it's really hard to keep them healthy.
Right.
And so once you have those pieces in place, it's sort of, I've interviewed a couple of these customers of these systems and they love it. Mm-hmm. It just makes their life so much easier where they don't have to wonder, why their blood pressure went off the scale, like, at that moment, like they can intervene.
Right.
I mean, if you think about it, this little unit I'm holding up, which is the size of a credit card, I put my 2 fingers on each side and it's called, it's from a company called AliveCore. It'll do a 6-parameter ECG of my heart.
Wow.
Right? $80, right? The AI will look at the pattern and tell me if there's something wrong.
Yeah.
So I'm at home and I feel like something's happening, right? I can get on my telehealth system and use this. I mean, it's not as good as the ones at the hospital, but it's getting better and better like all the time.
Yeah.
Between that, this blood pressure cuff and, maybe another device, and all of a sudden that physician and or nurse has information that they wouldn't have had 5 minutes ago.
Real data they
can make a difference with the patient.
Yeah.
I'm waiting for that blood sugar monitor without a needle.
Wouldn't that be
so?
something?
I don't have it on now, but I've had the continuous glucose monitor on my arm. I'm not diabetic. I'm perfectly healthy, thank God. But I use it to figure out like what foods spike me because there's so many people that are pre-diabetic and don't know it. And so you can be wearing that and just take your phone and wave it over that and see what your blood sugar is.
Is it a patch or do you still require a microneedle to
It is a microneedle, but you can't feel it. I mean, once it's in, first of all, I didn't feel it going in. And then the second thing is, after a day, I'd forget it was there because I'd be like taking a shower and be like, oh yeah, I forgot it's on my arm. But after every meal, you can just wave your phone over it and it'll give you your blood sugar levels.
So this NFC technology.
Yeah.
Near field.
Yeah. Well, it's using Bluetooth basically to pick up the data.
I love it.
And you can send that to your doctor. You can look at it on the app yourself. I mean, the new update to the Apple Watch will actually, when you go into AFib, will actually automatically record the AFib event.
Wow.
So you can share that with your doctor.
Wow.
Right. So, if I look at it this way, if you're young, technology can sort of help you keep in the right track, which will hopefully push off any bad dynamics. If you're older, it can help you monitor, keep you healthier, and sort of maybe course correct bad habits. And then if you've got a chronic disease, it can actually help you monitor that chronic disease much more accurately. And we all know the better you monitor that chronic disease, like something like diabetes, those comorbidities or the other things that the diabetes causes go down.
Just for our audience sake, the patch with the blood sugar monitor, is it something they can get like on Amazon, or is it something you're just testing out?
No, there's unfortunately in the United States, technically you cannot get it without a prescription from a physician, although there are 2 companies now, one called January AI and the other one called Levels. And you call them up, you go through a questionnaire, a physician will then prescribe this to you and it shows up.
No way. Levels?
Yep.
L-E...
Levels. And January AI is the other company.
Do you have any connection with that? And we'd love to talk to them about that. I'd be future guests maybe for the show here, because I didn't know anything like that exists. I didn't know.
Yeah,
yeah. And by the way, all of these things we're talking about and more, all of that is covered in the book.
Okay.
Wow.
Oh, good. Okay, that's what I'm trying to get at.
Just trying to bring it down to, anybody should be able to read the book and really understand where things are today and where things are going.
Mm-hmm.
I see. Levels Health. Unlock your metabolic health. I found it.
Okay. Yep. There you go.
Yeah.
So while Dr. Trin's looking these things up, tell us what you're doing in this field. You're not just writing books about it. You're actually an active entrepreneur or VC, or are you investing in things or helping develop things, or what are you working in?
Yes. So I'm my day job, or how I pay the bills would be I'm in venture. I'm a partner at a venture fund. We actively invest in that intersection of biology and data. So it can be something near the patient, like we're talking about, or it could be how to discover and develop drugs faster. So it's a pretty wide remit.
Wow.
So I spend my time looking at companies, talking to companies, coaching companies, investing companies. And then I write my books, because that really forces me to stay on the bleeding edge.
Right.
Yeah.
And I have a podcast where I interview people on the bleeding edge, trying to understand those little nuanced details of why and what and how and who, right?
Give us the name of the podcast. Let's give it a plug here.
It's the Harry Glorikian Show. It's pretty simple. It's my name.
All right.
It's my name.
And let's spell your name for those of us that are challenged with names here. How do we spell that?
So Harry, Harry, and last name is Glorikian.
Okay. All right. And we can find that wherever podcasts are found, I'm assuming here.
If you just type the Harry Glorikian Show, it should come up. It's syndicated everywhere.
So I don't know whether you know, but we're this studio, this station that it runs over, this unique internet radio station, is streaming live from our studios here at the University of California, Irvine's Beale Applied Innovation Center. Fancy word for what every campus is trying to come up with, a place, a space to take technology being developed on campus and turn it into something. Maybe it's licensing it to others. Maybe it's actually build companies. So the building here is filled with people like you, VCs, incubators, accelerators, coaches, mentors, and stuff, all as technology. Some of it's student-driven, but most of it faculty-driven. As they're developing new ideas, and UCI is known for medical devices. That's kind of what their specialty is, medicines and medical devices. They have a wet lab here on the top floor where they're trying to develop new drugs. And on the second floor, they have an incubator and accelerator program where they're trying to take technology, as well as a licensing program, try and take stuff and bring it to the business world and bring it to life, turn it into something. So we'd love to, if you're interested, I'd love to introduce you to the director of the program here, because this place is filled with the kind of stuff you're looking for. And I know you're on the East Coast and we're on the West Coast, and the two don't often meet, but this might be an interesting connection for you here, right?
I was born and raised in San Francisco. Half my life was out there, and half my life is here. So I'm a child of both coasts. Okay. So I love it. I'll give you guys some examples that people can really like.
Right.
I mean, I know the continuous glucose monitor and the blood pressure should be something that people can implement today. But what if you had a child with ADHD?
Yeah. Okay.
What's typical, right? Somebody gets prescribed medication, Adderall, Ritalin, something like that.
Right.
What if I could prescribe them a video game?
What?
And they could play a video game.
Right.
And by playing that video game, it would strengthen that part of the brain that cannot stay focused. And by the way, it's FDA cleared. It's gone through a clinical trial. It is reimbursed, and it is doctor prescribed. You can't just get it. Wow.
Amazing.
Game changer. Yeah, because I know people with children with ADHD, and the difficulties they suffer in school, and the people getting called in for parent-teacher conferences. Your kid won't pay attention. He won't sit still. They're disruptive. Maybe they're even depressed because they're not fitting in or following along or all this other stuff here. And yeah, the option has been to drug them up. And everybody's saying there's got to be some other answer than keeping them drugged all the time here.
Absolutely.
Yep.
What have you seen in the world of dementia and Alzheimer's?
Yeah, that's Dr. Trin's specialty. Right.
We do clinical research, phase 2, phase 3 for dementia, Alzheimer's care, and so lots of technologies popping up for cognitive screening technology, where you have medical devices like the CogniView device, or medically cleared, or you have straight out of the internet, you can go on there and do a cognitive screen. I've seen those technology; those are all billable. But is there anything on the treatment side using AI? That's a huge challenge. Obviously, we're still looking for that magic drug, right, to remove the amyloid plaque and all that. But can we use AI? Can we use technology to help slow down the decline of memory loss, or to help improve somebody's brain function overall?
Could there be a video game for that? Could there be a little memory test to strengthen your brain or something here and fight this decline?
Well, if you remind me, I'm going to send you a paper when we get off. There was a huge paper that came out where the fundamental amyloid plaque paper that got written, the data was fabricated.
What? What? Oh my God.
This is not the cassava study, right?
No. This just came out. I think it was published in Nature or Science. It was a big deal that there was a big cover. Everybody assumed the data was right, and then everything they did after that was based on that data. So millions of dollars went down the wrong road.
Right.
Basically. But that said, I mean, what we're doing is we're getting better by screening, using AI to look at the images, et cetera, subclassifying patients better. That's one.
And let's stop you right there. Stop you right there for 1 second, because Dr. Trinh has talked about this at length as he's done shows on. He's on the board of Alzheimer's OC here, and he's had people in, and they've talked about this at length. How difficult it is to categorize them correctly, because there isn't a blood test that says you have Alzheimer's. Not yet. It's a guessing game, and you rule out this, you rule out this, you rule out this, and finally you do it. And in the meantime, you're not treating the patient. The patient's not getting the right care. It might be this. It might be this. It might be a yeast infection that's making you seem like dementia or something here. All sorts of things. So yeah.
Yes, but I believe, and I could be wrong, there is one FDA now cleared blood test from Roche.
Wow.
Literally, I think it happened in the last month.
Oh, wow. Okay. I haven't talked about that.
It just got approved. I have not read, I think it's the first amyloid test for Alzheimer's disease that got FDA approved. But I cannot remember.
Yeah, I saw that. I think it was fast track or something like that. Let me see. Blood test. Roche FDA amyloid blood test. I saw that headline.
Because that's been one of the fundamental problems with that disease and getting the proper diagnosis is you're guessing. You're ruling out everything else until you can come up with. Yeah.
Roche Alzheimer's blood test earns FDA breakthrough.
And I think there was another one from Fujiri Bio, but that is a spinal fluid test, whereas Roche's is a blood test. But I think they're looking at different things.
Absolutely.
So those are two examples. But let me give you another one that isn't Alzheimer's, but Parkinson's.
Right.
Yeah.
So I just interviewed them for my podcast, and it's a company called Rune Labs, a bunch of software guys, where they have come up with a piece of software that functions through the Apple Watch, because Apple Watch has an API into their movement function. and they are able to tell you how well a treatment might be working with that patient because they can detect all the micro movements. Now, they also have a deal with Medtronic. And so,
which is next door to this building. Medtronic's West Coast
Yeah.
headquarters is right out here. Yeah.
Yeah. And so if they put in a deep brain stimulus device, right, to help you. So imagine all that is picking up all your brain activity.
Yeah.
So you've got all the brain activity that's going into the system, and you've got all the information coming off the Apple Watch
As to movement, technology. whether you're still shaking and stuff here. Yeah. Right.
Right. And so now you go to the neurologist and they're able to see, oh my God, I gave you that medication at this level and this is what happened. I gave you that medication. All of a sudden, instead of shooting in the dark, there's a data-driven metric that you can use to.
Wow, we're getting you to cut out there for a second on your connection here.
Yeah, that's amazing. Yeah, we've had a number of patients with the deep brain stimulus, and sometimes they overshoot and they freeze, and other times, yeah. So having this data and then being able to adjust your treatment based on that is amazing.
So
yeah.
We're gonna give your internet a chance to recover here.
But you can actually measure the movement.
The tremors.
Yes. And so now you've got a triangulation capability.
Yep.
And I love talking to that company because you can see like how immediate that becomes. And then all that data allows you to say, well, wait a minute, this type of patient is different than that type of patient.
Right.
So maybe there's two types of Parkinson's going on here, and we can start creating subclassifications, just like we did with breast cancer.
I never knew that anybody was looking to subcategorize. My late mother had Parkinson's bad, and so I'm very familiar with the effects of that disease, including dementia that came out of it that we didn't know back then or weren't prepared for, and the side effects the crippling side effects that come out of that. And everybody just shrugged and said, "There's nothing we can do. There's nothing."
Yeah. So in my experience, like, every single time we label something with one big giant label, it's not one label. There's probably 3, 4, 5, 10 variations on. I mean, we used to say breast cancer. Nobody says it's just breast cancer anymore. There's a type that's applied to it, and that drives a therapy, right? And all the diseases are like that. There's not just one
version and one treatment.
Yeah, there's not just one version, right?
Right.
It's the multiverse, right?
Yeah. Same thing with Alzheimer's and dementia. What about precision medicine and cancer? I've seen the.
You talking just about dosages and directing it to the tumor, or are you talking about measuring it, monitoring it?
I've seen the blood tests availability of detecting pre-cancer based on genetics and things of that sort, looking for a variety of cancers through a blood test, just early detection.
Yeah, so I cover all these in the book also.
Yes.
But essentially, when you think about it, because I mean, I was involved with, I was at the company that did the Human Genome Project way back when, and
wow.
You learn a lot when you're doing that. But basically, if anybody, who's listening, just to put it into thing, every tumor is different.
Yep.
And every tumor has what I call a certain personality. And so if you genetically sequence that tumor, you get to understand the personality of that tumor, and therefore you understand how you would attack it or manage it. Now, today, there are actual drugs that if you have a certain gene sequence, that drug will work on it. It's a targeted missile against that gene sequence.
Right.
So it will work more effectively than, oh, let me start with this and then let me give you that. And if that doesn't work, let me get, because that's a guess.
Right.
So this is more precision or targeted medication. And now we're going to, well, what if we give you a combination? Right. It's like whack-a-mole. If I hit enough of them, I'll take out the target. We've now figured out through neonatal blood testing that we can also see in the blood tumor DNA that is sloughed off from cells that die.
Wow.
Right. Now, we found that out by accident because when they were doing the original neonatal testing, somebody said, this doesn't look right.
Mm-hmm.
And we said, do we call her and tell her? Right. And they were like, yeah, we should. And of course, they let her know. They found that there was a tumor there. She had the baby. They immediately were. And, she said, this saved my life. Right. So then it went on to, and then, of course, nobody believed us that you could see something early. And by the way, the system didn't pay for it.
We're back to that old problem.
Yes.
Yeah, right.
What
exactly.
happens is where can we really focus our efforts? And it's therapy monitoring was the place where we spent our time. You had a tumor. We took out the tumor. Is the therapy we're giving you working or not? And so we can test your blood to see how well that therapy is working. Mm-hmm. Now everybody's really trying to move on to the early detection side. Right. Excellent. But those are big, huge studies that need to be done over a number of years to really be sure, how well we can detect it. And everybody talks about a pan-cancer assay. I'm not sure if we'll have a pan-cancer assay, but I think we could see enough of them.
Liquid biopsy.
It's a liquid biopsy where every year you could go in, give a tube of blood, they do the screen and tell you, Paul, you're fine.
A liquid biopsy. You'd throw out these terms casually. There's something I've never heard before. I don't have to cut out a piece and take it to a lab and tell you what it is. Is it benign or malignant? I can do a blood test and, as you said, pan across a variety of possible cancers and screen for stuff. That seems cutting edge. That seems futuristic. That seems science fiction.
Today.
No, it's today. I mean, there's a company in Northern California called Guardant Health, publicly traded. They do a lot of the therapy monitoring, and they're trying to move upstream to early detection. There's a company called Grail that Illumina bought. They're down in San Diego. Yep. And there's a number of companies out there that are trying to go down this road. Some hospital systems are trying to develop their own internally. But imagine that you can see it before the tumor forms.
Yeah.
Yes.
Wow. What could you do to prevent the formation of the tumor, or to flush it out, or to prepare for it, or whatever?
We have tumors forming every day, though. I mean, tumor cells form every day. It's just that we never know about it because our immune system catches it and eradicates it. It's when it escapes the immune systems when we're in trouble.
Oh, there you go.
Right.
Okay.
Right. The body is an amazing, absolutely fascinating machine. I mean, it does a really good job managing itself. It's just when Dr. Trinh said, when something goes out of line, that we need to go and then interfere.
Give a plug again for one of your past guests, Dr. Trinh. I know he's a friend of yours. I forgot the name of the company. Is it Neurologic, or who's the guy with all the remote monitoring stuff's been on it?
Oh, that's NewsLogic.
NewsLogic, yes, right.
With Huan Yu, who owns like 3 healthcare companies, but he's deep into remote patient monitoring. And we actually went to Vietnam a few weeks ago, and he was on our team. We did medical missions work in Vietnam, up in the highlands, up in the mountains, and he brought his devices, and we're trying to figure out how can we provide remote health patient monitoring to folks who live in other countries and
who don't have access to a doctor, but could maybe be fitted with something simple to.
But they have a cell phone, right?
Yeah.
That have access.
Well, that's. I mean, there are things like that are happening where somebody goes in, they get a diagnostic test, and the result is sent via cell phone. Mm-hmm. There's remote systems that you can use that will uplink through a cell phone. I've seen very small diagnostic devices where they've taken all the brains out of the machine. Mm-hmm. It's just the testing system, and then it shoots all the data over to a cell phone, and the cell phone is the brains that then, but I can see how these technologies we're talking about will make, you could see universal healthcare for, places that never had it.
Yeah, exactly. That's what they're talking about. The fact that, Dr. Trinh, in addition to all the things he does, has this thing called Tongue Out. They do medical missions. He brings UCI medical students and doctors and ordinary people and takes them up where he's from, where he's familiar, up into the highlands of Vietnam. They go visit people in remote areas that haven't seen a doctor in forever, and go to other countries as well. But that whole notion of taking medicine to the people, of turning that cell phone into a diagnostic and communications tool, because wherever they are, they have cell phone technology. In the the most rural villages in India or Africa may not have clean water, but they have a clear signal. And
dirt poor, don't know where their next meal is coming from, and they have an Android cell phone in their hands. That's how it is in the third world.
Yeah.
But think about it, right? I mean, Musk deployed Starlink, and receivers for, Ukraine.
Yeah.
Changed the game of their community. If you had Starlink or something like that, where there could be a communication link from anywhere.
Right.
Now it's just whether you're streaming YouTube or you're streaming medical data, you can do it from anywhere.
Right. And then could you come back? We talked about this in one of the other shows. This seems a way off, where then a doctor could respond and say, I know you're in the middle of a village in India or Africa or up in the highlands in Vietnam. We see you have a problem. There's somebody with some minimal training there. Can the doctor walk them through treatment, or maybe even someday fantastically surgeries or other sorts of things? Could they somehow communicate back to the patient or to some minimally trained person to help intervene and offer some sort of treatments to these people? Or do you still have to fly doctors like Dr. Trinh into the middle of these remote villages?
I think it depends on the condition, right? Obviously, there's a point you don't want to go beyond.
Right.
But if you know the GPS coordinates of that person, you know exactly where they are. We do that today. You just need permission to ping the person back, and I think you can do the second part.
Right.
The third part, so what if I gave you a little device and you could do a ultrasound on the patient, and the machine would tell you, okay, a little up, a little to the left, move down, blah, blah, blah. And then the quality of the image is equivalent to a trained ultrasound technician.
Wow.
So AI will let the average person do that.
Do your own ultrasound at home. Yeah, like taking your blood pressure. Yeah.
Does that device exist today?
That device exists. I just cannot remember the name of it right now, but that device exists. Well, think about it, right? The ultrasound is doing what it's doing. It's just how do you position it to get the right image? And so the machine is looking at the image and going, no, move a little left, a little down, a little to the right. And you get that result. Now, all of a sudden, the remote doctor has a clear image to make a better determination off of. Mm-hmm. And so then can they be more accurate in their description to someone managing that patient?
Right. Okay.
Absolutely. I think the big gap with telemedicine is that physical exam. Mm-hmm. And I've seen a few devices where patients can have this digital stethoscope and kind of put it on their chest, and it records it and sends it to the doctor. But I think once we figure out how to do a physical exam from a distance, that will complete the full circle of virtual medicine. Would be amazing.
So I think 80% of the devices are there. I mean, there's now a urine analysis test where you can equivalently monitor yourself. Your kidney, by the way, just got approved for kidney monitoring.
Right.
You just pee in a cup, put it on this little device, take a picture with your cell phone. The software will automatically diagnose it based on the color change on the little card.
Wow.
And off you go, right? It's a company out of Israel.
Wow.
There are digital stethoscopes that will hear things that there's no way that the human ear will easily hear, right? All of these devices are there. Are they integrated? No, but many of them are there. And I would say that in the next, I don't even want to say 5 years, because that feels like an eternity these days. It's like the next 2 or 3 years, you're going to, people say, well, do you believe everybody's going to have a wearable? I'm like, Well, if you don't have a wearable, you're like putting your life at risk. Like, would you drive a car without a dashboard?
Yeah, right.
Good point.
Interesting. Would you drive a car without a dashboard? Would you blindly guess your speed and all the other parameters that go into operating a vehicle here? You're operating your body without any insight as to what's happening, just how you feel.
Yeah. And there's an article, I don't know, every week. There was one recently where, the woman's Apple Watch, through monitoring of the heart, noticed that there was an aberration, and she actually had a tumor in her heart that was causing, just literally in the last 10 days, there was an article that came out on that. And I'm like, okay, if you're not wearing it,
wouldn't have caught
you're
it.
sort of taking your life into your own hands.
So it seems like we're going to get to a point where we're going to have some sort of wearable device. It's going to be monitoring us. It's going to be sending that data to some healthcare system provider, whatever of our choice. And then they're going to respond quicker. They're going to get alerts. They're going to make better diagnosis, and hopefully will not only reduce costs, because we'll prevent emergency situations from happening, but we will increase results. How does that fit into you? Last question. You talked about a topic that I find fascinating. We've touched on this show, the transition potentially from fee-based services, fee for service. You come, I see you, I bill you, and you don't come till you think something else is wrong. So it sort of encourages you to delay, to wait. I'll wait and see what it is. Is it serious enough for me to go pay for it? And so I put off, to this notion of value-based medicine, which is all about results. I'm paying you for a result, and it's up to you to roll the dice and figure out how to treat me. I'm going to give you a set fee, and for that fee, you better manage my care. And don't come back and ask for $10 more or $10,000 more to do the operation. You've agreed to monitor me and keep me healthy for a certain fee. What do you think about that? Does this help get there? Does it give them more confidence to take that risk?
Yeah. So if you go back in time, when we went to the first start of precision medicine in oncology, I remember having a conversation with the FDA saying, and they were like, that's it. We're going to start asking for biomarker data from pharma companies because the technologies now makes it possible, right? Those excuses of we can't do it no longer exist.
Right.
If you look at Medicare and Medicaid, they're moving towards value-based payments, and they're about 55% there, maybe a little higher at this point. I haven't looked recently, but technology and monitoring allows you to keep the person in that band, right? And it becomes easier because it's not like you need to sit there and hold their hand. It's technology plays a role in this. Now, of course, there's a bell curve. There's the super, like, I'm going to stay on track no matter what. There's the average person that's, it's going to stay on track 80, 90% of it. And then there's a few people that are going to be like, listen, I'm going to smoke, I'm going to drink, I'm going to do whatever I want.
Can't stop me.
Those are probably the people where we're going to go to them and say, that's fine. Here's your extra charge, right? Because you're not staying in line, and that's your own choice, but do what you will. And that is now opening up, I think, in a big way. I think physicians need to think more like a private equity firm, where how they optimize the outcome rather than the typical entrepreneur that's sort of, you're making a nickel on every transaction, right? I think it's just a little different.
Because that's what medicine, in my opinion, and we've kind of expressed this a little, I'm certainly no expert in this, just an average Joe when it comes to medicine here. But it seems like the system is set up to discourage me from using it, because every time I go, I get nickel and dime, and I go into the hospital and I get this long bill for aspirin and for every time somebody touched me and everything else here and everything. So my incentive is to stay out of that system, to stay away from it until I have no choice. And then I come rushing in and it's too late. Why didn't you see me earlier? Why didn't you prevent this sooner? Why didn't you adopt a different procedure? Because you're charging me every time I come see you.
Okay, but here's, I think, the big difference. You were dependent on the system 100% no matter what before.
Right.
These technologies now allow you to clue yourself into your own being.
There you go.
and be more informed and maybe make changes yourself before you have to go into the system,
Absolutely.
right? So
Right.
it's empowering individuals to take charge of their own healthcare.
Mm-hmm.
Now, I still would say, listen, if you have a serious problem, please go see your doctor.
Sure.
But
Yeah.
I've learned so much about my sleep and my workouts and my eating just from these technologies sort of giving me a clue, right, into what's going on, that I would have never have been able to do that without these capabilities.
Much less if it was measuring my formation of potential cancer cells and my genetic predisposition for things, and
Absolutely.
and my spikes in blood sugar and other sorts of things here that you've talked about here. Yeah, I think that's a really powerful point, because we all want to be
Amazing.
more empowered. We all want to take more control of our own lives and be less dependent on others. That's just an
But,
American ideal and a consumer ideal. And I think this allows you to do that, to be, you're driving the boat. Yeah.
Love to have you back sometime, Harry. Have more discussions on this. This is
Wow.
it's amazing time. Thanks for coming on today. We appreciate it so much.
Yeah.
No, thank you so much for having me. You know, all of this stuff I talked about, I cover in the book, but I mean, there's so much going on that we could talk about, so many different aspects that I think that people can incorporate into their lives and make a difference.
We'll
So
be
give
getting
it-
your book.
And give us the name of the book one more time. It's a long title, but it's got a lot to tell here. So
It's the name of the book is The Future You: How Artificial Intelligence Can Help You Get Healthier, Stress Less, and Live Longer.
there you go.
Thank you so much. God bless, and we'll continue this chat.
Yeah. Hang on for a
Thank you.
second afterwards, and we'll connect you with a couple other people here. So hang on here.
Okay.
All right.
Thank you.
Thank you.
There you have it. Another great example of why you got to tune in each and every time to Health Talks, right here in Orange County's only community radio station, octalkradio.net. Streaming live from the University of California, Irvine's Beale Applied Innovation Center.